Today we'll be talking about bacterial vaginosis. Bacterial vaginosis is basically the disease of the vagina having too much bacteria, excessive growth of bacteria. And that's when there's more lactobacilli, which is the bad bacteria, more than the good bacteria, the anaerobes. Bacterium is basically cultured through your urine, pap smear, and vaginal discharge. They'll have also an exam of your pH level of your vagina to see if you have bacterial vaginosis. As you can see here, I have a photo of normal cells and a photo of clue cells. That's usually what they look for when it comes to culturing what they have of you. The isolation can happen by endolysin and as a treatment against the bacterial infection. Then you have your life cycle, which is usually by sexual intercourse. This is when the trophocyte in your vaginal and prostatic secretions in your urine, which actually multiplies into binary fission, and then your trophocyte in your vagina or your urethra. And then it's an ongoing evolution. The whole process of the bacteria is from sexual acts that can happen if you have multiple sex partners. And douching does not help when it comes to bacterial vaginosis. It just basically imbalances your whole vagina. And that can be acquired, as I have a photo, the doctor can swab the inside of the vagina, and then that's tested for the bacteria, and as I showed, they'll see like the clue cells. There is usually a reduction of normal hydrogen peroxide producing lactobacilli in your vagina. There is a lot of things that can increase the risk of bacterial vaginosis, like I said, multiple sex partners. Your IUDs and your birth control, that can actually trigger bacterial vaginosis to make more bad bacteria than good bacteria. And if you're on antibiotic, that can cause a bacterial infection as well in your vagina. And smoking and vaginal douching, like I was saying. Some symptoms that you can have is gray, thin, white vaginal discharge, abnormal vaginal fluid. You can have a fishy vaginal odor and vaginal itching, and your urine can actually burn. As I have photos of what the inside, if they gave you a pelvic exam, what it would look like. Doctors can diagnose by asking you your medical history, pH test, pelvic exam, and gram stain. And that's when they see the clue cells from the gram stain. And then treatments are usually the metronidazole, and they can give you clindamycin. And for pregnant people, you can't take it after a certain trimester, so you have to ask your doctor when's the perfect time for you to take it. A way to prevent bacterial vaginosis is by decreasing vaginal irritation by using mild soap, Dove sensitive skin soap. Unscented pads can actually help in not over cleaning your vagina, because the vagina is kind of like a self-cleaning thing. And that over cleaning it can mess up your pH. Low number of sex partners, or you could just be abstinent. And that's the end of my presentation.